Hi, Kate Collins, staff scientist here from TELUS World of Science, Edmonton. Today we are here to talk a little bit about COVID-19 and pregnancy, and we are joined by Dr. Julia Parkman, who is a resident physician in Obstetrics and Gynecology, as well as Maura Armstrong, who is TELUS World of Science Edmonton's Director of Education and happens to be expecting her second child right now, so she'll be able to tell us a bit about her experience. Thank you so much for joining us today.
Thanks for having us.
Yes, thanks for the invitation.
Awesome. So, Julia, the first thing I was curious about, what do moms-to-be need to know about pregnancy during the pandemic? Has anything changed?
First of all, the pandemic is relatively new, and so there's actually not a lot of information available about the effects of COVID-19 in pregnancy. A lot of stuff has stayed very similar. We're trying to reduce visits and in-person visits between patients and their providers if possible. A lot of things will need to be done in person, such as listening to baby's heart rate. One thing that has changed is the way we screen for gestational diabetes. Currently, it's changed to a single blood test, whereas before we used to have patients drink a sweet drink and then test their blood after. Another difference people will notice is that when they come to the hospital in labor, they'll be screened for symptoms of COVID, as well as recent travel or contact with patients that tested positive for COVID, and will be given a mask to wear. They'll notice that doctors and nurses in the hospital will be wearing a lot more PPE, such as masks and eye protection. And also that currently the policy is to have one support person only in labor, whereas previously people were able to have multiple people.
That's interesting about the gestational diabetes, and I guess it'll be interesting to see if any of those changes last beyond COVID-19.
Yeah, I think that will be interesting.
I'm curious to know, Julia, when that was implemented, because I was screened for gestational diabetes a couple of months ago with the drink, the delicious orange drink that they give you. Is that a recent change that they've done that?
It might, to be honest, it might not be everyone making that change. It was a statement put out by the Society of Obstetricians and Gynecologists of Canada saying that this is a change we could consider to try and limit exposure of pregnant women to the additional exposure to patients, and also to preserve resources. But some people may still be doing the other one as well.
So Maura, knowing that this is your second child, have you found that your prenatal care has changed since the pandemic started?
Well, I think it's changed just as much as anybody who's visited the doctor will notice. Very limited appointments are allowed. So most of the people in the waiting room are pregnant or maybe dealing with a more serious issue, and no visitors. So that was a bit of a challenge when childcare was no longer available. I had to bring my 4-year-old to an appointment, and everyone was a little bit nervous, but he managed to get through without touching too many things. We were sanitizing a lot. So just that inflexibility has a few challenges, a few hurdles. Going for lab tests, like I mentioned, I was screened for diabetes and a couple of other things, and it's a different experience. If anybody who's gone for blood work can tell you, it's very strict, very restrictive, and that was reassuring because I definitely didn't want to be one of the statistics. So the care has been the same. I've gotten everything that I've needed, but it's just been kind of different in quality, and there's very much a heightened awareness of transmission. My biggest worry was not having support in delivery or postpartum, like not being able to bring my partner in. So I'm glad that at least I can have one person. That's the current plan, and I am due in just under 4 weeks, so it's unlikely to change before then. But I am a little sad that my son won't be able to visit his sibling in the hospital for the first time. I understand why the restrictions are in place. So.
Yeah, no, it's interesting how obviously as a pregnant woman, you do need a lot of care, but then also going into those settings does put you out in well, so maybe puts you at risk a little bit more too. So Julia, I guess going off of that, I've heard that pregnant women do sometimes have weakened immune systems. Are they at a higher risk of contracting the virus, or do they have to worry about having a worse set of symptoms if they do catch COVID-19?
Based on what we've seen from case reports, it doesn't seem as though pregnant women have an increased rate of transmission of the virus, and it doesn't seem as though their symptoms are more severe. That said, we are learning more and more about this virus all the time.
Okay, well, that's good to know for now at least. But yeah, I guess as we continue to learn, we'll find out more, and hopefully it stays that way. Maura, have you been doing anything special to minimize your chances of contracting COVID-19?
Well, early on in mid-March, I tried to find information about pregnancy and COVID-19, and like Julia said, there really was not a lot of reliable data, and so I basically just decided that I would be as careful as I could possibly be, since I didn't know, and it seemed like nobody really had a clear answer. So I think I've been doing a lot of what other people have been doing, physical distancing and masks and hand washing and all of that. My husband has been in charge of all of the grocery shopping for the last couple of months. So I've limited my exposure wherever I can.
Yeah, that feels like the right thing to do.
Yeah.
So Julia, if an expectant mother does end up getting diagnosed with COVID-19, do they have to worry about that being transmitted to the baby?
Again, all we have to go on is some case reports, and there have been some cases where babies have contracted COVID-19. It's a little unclear if that's in utero or postpartum. There's been some back and forth recommendations on breastfeeding if moms that are suspected to be COVID-19 positive. Obviously, it's a balance. No one likes to separate mom and baby, and I believe a lot of places are currently promoting breastfeeding with the mother wearing a face mask.
Okay, that must still be really tough to have to sort of have more separation from your baby, though, at that time when they're so new.
Yeah, I'm sure it is. It's again, we're learning more about this virus every day, and it's a balance between trying to do what we can to prevent transmission and still providing quality care and allowing people to bond.
I know that it is possible for antibodies to be transmitted through breast milk. Is it possible that COVID-19 antibodies are available to the infant?
That's a really good question. And antibodies for sure are transferred between mom and baby, both through the placenta and through breast milk.
So Maura, knowing that you've gone through this experience, do you have any advice based on what you've learned for other expectant mothers?
Everybody's so different, and these choices are so personal. I would say my only advice is to trust your caregiver, your doctor, your midwife. They are working really hard to follow the most current knowledge and to give you the best care possible, and they are going to take all of this into consideration. So yeah, try not to go down the Google whirlpool because it can be very anxiety inducing and not really give you much benefit.
Yeah, that makes sense. So, Julia, thinking about that, I know that many of us, myself included, have been experiencing increased stress and anxiety during this time, especially if you end up getting caught in a Google rabbit hole where you're reading all sorts of things and it's hard to know what to believe. Do you think that that stress and anxiety that we're experiencing could have an impact on the baby?
There's not really solid, conclusive research evidence to show effects of stress on pregnancy outcomes. There's been lots of stressful events in history, and babies are born all the time through that. I do think it's important for expectant mothers as well as everyone else to take care of their mental health and to contact their care providers if they have any concerns, because there are treatments and resources available.
That is nice to know that there still is that support network there, even though we're in the middle of a pandemic. Well, that wraps up the questions that I had for you, Julia. Maura, did you have any questions that you wanted to ask?
Yeah, just springboarding off what we just said, I wonder if you have any advice for those of us who are pregnant, how to manage the huge amounts of information that may vary in accuracy and reliability, and also things that are just very clearly inaccurate at a time like this. What's your recommendation for finding and accessing reliable information?
I would stick to government websites as well as information from the SOGC. They have a patient websites as well. And then any questions I would ask your care provider, and to try and stay away from Twitter and all the other sources of information that are hard to evaluate.
That's good. That's very good advice. Stay away from Twitter. That might also help with the stress level at certain times as well.
Yep, I think so. Julia, did you have anything else that you're curious about to do with COVID-19 and pregnancy and what might come of it?
I think it will be really interesting to see what happens to the birth rates after the pandemic. I know some people have been predicting that there'll be an increase, and I think there very well could be, but a lot of families have also been hit very hard financially with the pandemic, and we have very reliable methods of birth control these days. So I think it will be really interesting to see what happens after.
Yeah, that will be curious to see how that impacts the future birth rates and whether or not that does seem to make a difference. Awesome. Well, thank you so much for joining us today, Maura and Julia, to talk about COVID-19 and pregnancy, and both what from a professional point of view and also from an expectant mother's point of view, what everyone is thinking about during the pandemic. And it seems like there's a lot that we don't know, but there is also a lot that we do know. And if we stick to the good websites, the good information, and listen to our care providers, that's the best way forward.
Thank you for inviting me, and congratulations, Maura.
Oh, thanks. Thanks for hosting, Cate. This is great.
So the first question that I had for you, Julia, was what do moms to be have to worry about during the pandemic? What has changed?
A lot of prenatal care has stayed very similar, maybe a decrease in frequency of visits. However, a lot of stuff that we do in the prenatal clinic has to be done in person, such as listening to baby's heart rate. We're learning more and more about this virus all the time, so recommendations may change. Some people are doing a different screening test for gestational diabetes instead of the normal one where the patient will drink a sweet drink and then we test the blood after. There's a new protocol that some people are doing where they just do a blood test. In addition, when patients come in labor, they'll be screened for COVID-19 symptoms and risk of exposure and given a mask to wear in the hospital. You'll notice that a lot of the nurses and doctors are wearing more masks and eye protection as well. And unfortunately, people are only allowed to have one support person in labor currently.
Okay. Yeah, it sounds like there's a lot of changes, and especially for things like the gestational diabetes, it'll be interesting to see if any of those changes carry through after the pandemic is over as well.
Yeah, will be.
Okay, I think that was a similar interaction, so that's perfect. I'll watch through the video tomorrow and then see what looks best. And Kyle is really awesome at editing, so he can just plop that in if it is better than the first time we recorded. But no, you did a great job, Julia.
That was excellent.
Okay, thank you. Thanks for having me.
Did I ask the question right after about the blood test? I can't remember, but he can probably slice that into, eh?